Chances are you've heard the expression, we need to listen to our bodies more. Well, researchers now think that they can help doctors diagnose irritable bowel syndrome by literally listening to it. An experiment nicknamed the Noisy Gut Project used an acoustic bell to listen to and identify complex patterns of sounds from within a person's abdomen. In tests, artificial intelligence was able to detect unique IBS sonic signatures and differentiate them from other sounds. When the acoustic belt was tested on study participants, half of whom had IBS, the software was able to detect IBS with 87% accuracy. The researchers expect to offer this tool to doctors in the next few years. April is IBS Awareness Month, and in the United States, between 25 and 45 million people have irritable bowel syndrome. We spoke with Dr. Garth George at Advanced Gastroenterology and Surgery Associates to find out more about IBS and how it's treated.
Irritable bowel syndrome is a chronic condition, and it's the most common reason that we actually see a lot of patients. The one good thing about irritable bowel syndrome that I tell patients is that it won't kill you. You may feel as though you're dying, but you're not. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can diagnose them with irritable bowel syndrome. Now, of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both, alternating constipation and diarrhea. But it has to be abdominal pain associated with changes in bowel movements. There are many various things that potentially could cause it. Stress, patients usually have more stressful situations when they get their symptoms. There is an entity of post-enteric irritable bowel, where patients who've had any gastrointestinal illness may develop symptoms of irritable bowel. The symptoms may linger. They may get better, but linger a bit longer than they normally do. The post-enteric can, in a lot of cases, run its course, but in others, it's lifelong. And there are many medications out there that we use to try to control the symptoms, but there's nothing really curable. We know that the colon has millions of bacteria, and most of the bacteria actually play a role in helping nourish the cells of the colon to do their job. So they're very important. And we know that when patients take antibiotics, a lot of patients can just get diarrhea from taking antibiotics, or they can develop what's called a colitis or inflammation of the colon. So we know that replenishing the colon with good bacteria is extremely important. Good old yogurt works as well as bacteria.
For more information about Advanced Gastroenterology and Surgery Associates and their services, please click the Listening to Your Gut StoryLink icon on our homepage at yourhometownhealth.com.